Hello, everyone. My name is Michelle, and welcome back to the Human Library podcast. In our last episode, we briefly touched on the topic of mental health and how it has been affected during the pandemic. And for today's episode, we will be expanding more on that topic, specifically on student burnout. We will explore the definitions of burnout, the reasons of burnout, and also why the pandemic has led to its increase. Today, we have with us a very special guest, and he will be here to discuss this topic with us. He is the Senior Professor of Psychiatry and Senior Consultant Psychiatrist in the Faculty of Medicine in UTAR, and he is none other than Dr. M. Parameshvara Deva, also known as Professor Deva by many of us here. Prof Deva has been practicing psychiatry since 1972 and has published 27 books on psychiatry. He was founder and past president of Malaysian Psychiatric Association, MPA 1977. Truly, there is no other person more fitting than Prof himself to discuss today's topic. Welcome to our show, Prof. We are very honored to have you here.
Thank you very much. Thank you. Nice to be
Hello,
here.
Prof. How are you feeling today?
Fine. It's a more relaxing day because it's Saturday.
Yes, agreed. Very grateful to have you join us this morning. Now, we will first like to explore the definitions of burnout. So to me, burnout is when we overexert ourselves after a long period of time of maybe, for example, studying, when we're doing repetitive actions day by day, and then we overexert ourselves. And there is a feeling of detachment from the job itself, and it can also have we will also have a sense of ineffectiveness and lack of accomplishment because of the daily struggles that we face. What do you think about this definition, and how would you define burnout?
Yeah, thank you very much. Actually, I purposely wanted you all to give the opening part of it by what you understand by burnout. The word burnout is actually a lay term. It's not a technical term. But it has become very much involved in technical part of medicine because of the frequency with which it is used. Somebody, I think probably around about 20 to 30 years ago, came up with the idea that people just get exhausted, they burn out like a candle. You burn, and finally you burn out. There's nothing left.
Yes.
That is a very simplistic view and not very accurate. I don't think anybody burns out and still lives. When you're living, there's still life, there's still some energy, something on. Yeah, you feel exhausted, yes. I think all of us have been sometimes, whether you're running on a cross-country run, or whether it is you're studying very hard for your exams, or you're sitting in the middle of an exams, you just feel exhausted, at the end of which you just want to collapse. So that is the understanding of burn out. You're burnt out already. Your candle is no longer alive. That doesn't happen. This actually doesn't happen. What happens actually is that a lot of people feel very tired after very stressful work, stressful events, and exertion, physical as well as mental, both. If you're going on a cross-country run, 10 kilometers, by the time you reach the 10th kilometer, you just want to collapse. But you're still alive. You're still alive. So the concept that you burned out, that you're finished, is not quite true. Not quite true. But people talk, and people tend to use a lot of superlative words. Somebody said, "Oh, this fellow is great. He's the greatest guy on earth." I mean, cannot be. There are 7 billion people. How the hell you know whether they are really the greatest or not? So this excessive emphasis on superlatives to the maximum degree or the worst degree is not rare. It's quite common. All of us use it. So the word burnout is usually meant to describe a state of exhaustion, tiredness, and both mental and physical. It can be mental, it can be physical. Of course, the physical tiredness we experience more often. More often when you're driving, when you run, when you work, when you're on call. For example, you're a doctor, you were on call. I remember when those days are nowadays not so bad. Those days when you're a doctor, as a house officer, you work in the morning, you start work at 7 o'clock in the morning, you go on and you finish work at 4:30. 4:30, your call starts. And the moment your call starts, they will start calling you and saying there's one case here, there's one case there, there's one case in the A&E, blah, blah, blah. So you have no rest. And those days, I remember the hospital I worked in, there was no canteen. So everybody goes
Oh
back for,
no.
people go back for lunch. Of course, as housemen, we were all bachelor boys and bachelor girls. We don't have a kitchen or anything like that. So we just have some snacks, some biscuits or something like that. So sometimes we don't even have a proper decent lunch. And then you continue working non-stop. From 7 o'clock you start, around 11:30 or midnight, finally no more call. All the people are asleep, so they don't call you anymore. At that time, you just want to hit the bed. You don't want to eat, you don't want to drink, you just want to sleep. And while you just
Completely
doze off,
exhausted.
and you're totally exhausted, and when you are just about to fall off to sleep, the phone rings, and they say there's one case of emergency. Jump up and run.
There's absolutely no chance for rest.
Absolutely no chance for rest. And by the time you finish your call duty, you'll be lucky if you had 3 hours of sleep.
Wow.
You have
That
interrupted
sounds.
sleep, about maybe about 2 hours now. Half an hour here, 1 hour there, like that. You'll be very lucky. I mean, I'm talking about a very busy general hospital with a shortage of doctors. Nowadays, the story is completely different. They're also very hardworking. There's more work to do, more details, more investigations, more procedures, everything. But comparatively speaking, I would think it's not so bad now. Anyway,
I see.
we're not here to compare that. We're just saying that the burnout you're talking about is a stage of exhaustion that most people feel when they are very, very taxed in their
Yeah.
physical and mental capacity. So that is roughly what
Prof,
it is. Yeah.
Prof, you've mentioned that the student burnout is not a very technical term and it's just been used a lot to describe a very common
Yes.
feeling that
Yes.
people feel because of exhaustion. If I understand correctly. So, Prof, what do you think is the reason for this, the use of this word student burnout? Do you think it's due to lack of proper stress management, or is it because
No,
of
I think
any
they are.
other reason?
No. I think they are using a word now. What it meant before and now, that's not a problem. The description is fitting. They feel very exhausted. They feel
Mm,
very exhausted. Mentally, physically, both. Mentally or physically or both. They feel that
mm,
I'm not in any way denying that they feel so-called burnout. The word being
mm,
used, it doesn't really mean you're burnt out and that you never recover. No, it's not true. You feel very tired, very exhausted, but you will recover. You will recover.
mm,
So the word they use is, it doesn't matter, like they say, alamak, apa nak buat lagi? You think that nothing more can be done? No, this is the difficult phase of your life. Sure, you
mm,
feel terrible now, but after a while you recover lah. You know. Ah,
I
so
see.
why they use it is they really feel tired. They really feel exhausted.
Mm,
Doesn't matter what it is,
mm,
whether it is running for a 100-meter race, or whether it is a 1 mile race, or when it's a 10-kilometer walk, uh, or it
mm,
is studying for an exam. The papers are exam like nowadays are not so bad in the medical college. The exam, the
mm,
total exam, practical, theory, oral, everything together, very
mm,
rarely goes on for more than 2 weeks. During my time when I was
mm.
a medical student, the exam goes on for 1 month. It's
1 month straight.
quite exhausting, quite exhausting.
Wow,
So
that sounds very
nowadays,
exhausting.
students also feel exhausted. We also feel exhausted. But
Mm,
there is a recovery. There's a recovery. There's a recovery. So why is that they feel exhausted? I think normal. There's a limit to the amount with which you can accept any kind of stress, any kind of overwork. There's a limit. All of us have a breaking point, and then you feel tired. But there's in medicine, since you're already in second year, in physiology, there's this muscle contraction and then muscle exhaustion. All these things. I've forgotten all the things in physiology. The contraction of the muscle,
relaxation. Yes.
all the things show that there can be a period of recovery. But when they're in the middle of it, they feel very exhausted. But after some time, they recover. That is the thing.
Okay, that's a very good way to put it. I think that gives me a new perspective as well. I guess I've never really realized that the word burnout really sounds like what
It's
you
not the
said.
end. It's not the end.
It sounds like the end of like a candle,
No,
but
no.
really it's not the end. It's just the middle. We just feel exhausted at that point in time, but there will be a chance for recovery. That is a very good way to put it.
Definitely.
Prof, for today's discussion, it will be quite an interesting one as we are having students phone in and share their experiences, and we will give you a chance to provide us with your response and advice as well. So, Prof, are you ready for our first caller?
Sure. No problem. I'm used to all this.
Now we have Mr. Anonymous here to join us. He will be talking about his personal definition of burnout and how it has affected his ambitions and hope for the future. Welcome, Mr. Anonymous, to our podcast. Thank you so much for calling in.
Hi, thanks, Michelle. Thanks, host.
Okay, so how are you feeling? And what would you like to share to our prof now?
Hi, Professor.
Hi, hello.
Yeah, I think burnout is the result of emotional, mental, or physical exhaustion when our stress level exceeded the coping capacity, right? Can we say so?
Yes, but I say the word burnout is misleading. It doesn't mean you're burnt out completely. It's a temporary exhaustion. So
Temporary.
it doesn't mean that you're forever burnt out. Means you're out already. There's no more in. You're out. So this is not so bad. You can recover from it. Yeah. Okay.
Okay. It's temporary, right? So sometimes I lose the motivation to study as we just sitting in front of the laptop screen and listening to the lecture for the whole day.
Yeah.
And I was thinking, is that medical school life that I want for? And will my next 5 year of study will be online too, such that the real-time face-to-face social life in med school will just end like this? So when this thinking keep appearing in my mind, I can feel my stress level getting higher and higher, and over the time, my emotionally drains and that I can't cope with it well. So even I disclosed to my family. So, Prof, did I have any? Do you have any advice for this?
You told your family this, is it?
Yeah, I disclosed this to my family.
Oh, what did they say?
They asked me to try out some exercise or other things to distract my
You
stress.
gave them more. You gave them more stress.
No.
No.
I disclosed to them that I feel emotionally drained with because I lost the social life face to face.
Yeah.
Yeah.
That just to clarify a little bit before I begin my answer. The thing that is worrying you most that you shared with your father and mother, is it more to do with your social life or wondering whether this online teaching will go on and on and on forever?
I can say there's an association between them, right? Because the ongoing of online classes, if the
Yes.
pandemic keep rising the cases, and then
Yeah.
we have to continue the not face-to-face
Yeah.
social life, right? So I got tell them mainly due to my social life the stress I don't have the face-to-face one. So
Yeah.
yeah.
Okay. Okay,
I would.
so can I ask? Uh, I don't want to get any details, but just to ask you, were you already in the medical school when there was no COVID?
No, I started
Yes,
medical school when there is a COVID, and
already
then
COVID. Oh,
yeah, it keeps online classes.
oh. So your year one classes is 100% online.
Yes, yes.
Any lab work or any practical things, anatomy or something like that?
Not really.
Really, I'm very sorry to hear this. I'm really sorry to hear this.
Yeah,
I didn't know this. I thought something like about 70-30 or something like that. You know, but when you say it's nearly 100%, if I was in medical school, maybe I'll tell my parents the same question. I can't
Yes.
imagine. I can't imagine 1 year after that looking at TV screen. The only difference for me is when I teach students on the online, my cat is by the side of me. My cat is very happy that I'm there. So he keeps,
Mm.
there's a face-to-face cat and a face-to-screen. Anyway, very sorry to hear this. I'm very sorry. That's why in year four, I started a stress management clinic before the COVID, where we see, I can send you the pictures if you want, about 8 students see one patient, or 4 students see one patient, 4 students see another patient. Live, real patient. No simulated, real patient with stress, not psychosis, not gila. I'm talking about anxiety, depression, problems in work, problems in marriage, problem in college, problem in school, all these sort of things. So the students get a chance to talk to the patient live. When the COVID started, I said, hey, psychiatry is mostly talking, isn't it? So we can do it even with a handphone. Use your, what do you call it? FaceTime. So we did it. We managed to get 2 patients who are computer savvy. They got their own computer, got email access. So we saw 2 patients online for getting the history, diagnosis, and treatment. Now, for medicine surgery, of course, more difficult. Maybe you have to have gloves and full PPE and examine the patient through a plastic screen or something. I don't know lah. So that is up to them to decide. But if it goes on 100% like this, it's very stressful. It's very stressful. I empathize with you. But like any other problem in life, there's always a solution. There's always a solution. So there should be more opportunities for face-to-face with all the PPEs. Our PPE should be 150%. So this is up to the teachers and the students to work out. You know? So I can understand your stress at not having any kind of direct contact with what you're doing as a future doctor. I can understand that much more than the students in the clinical years who feel bored,
Yeah,
because there is much bigger chance for the patients for the student to see patients or even simulated patient, real patient. Personally, in fact, yesterday I was online with the doctor in the KK Ampang. They told me, Prof, come anytime. We allow you to come see patients, but waiting for UTAR to give permission. So only 3 departments actually are seeing patients face to face. I asked the students on the last batch who are now in year 5. I asked them, in year 4, which are the departments which allow you to see patient face to face? They said psychiatry in the stress management clinic, ophthalmology, that's my wife, Prof Jenny, also face to face. And they said one more. So which is that one? He said, this is the forensic psychiatry, dead bodies. We also see dead bodies face to face, but not live.
You can
Not
only
live.
interact with dead bodies.
But I feel that even in medicine, surgery, pediatrics, orthopedics, ONG, you can take a history by phone. Don't you think it'll be much better, at least to take a history by phone? You can talk to the real patient, man. So we need to discuss this and work on this, lah. So what is my advice to you? I think you keep yourself, like I said, the YouTube definitely has got enough material for anatomy, physiology, biochemistry, enough things on the YouTube to keep yourself occupied. And then some of you may actually have ideas to suggest to the lecturers. Why not we have a PPE, plastic screen, and deep gloves where we can palpate the patient or whatever it is, and a lab that is completely sealed, and we do all this. So this is up to you all, because I think nobody really knows how to cope with COVID. I spoke to many friends overseas in other countries. Same problem. I think we should not give up so easily. So to Mr. Anonymous, I'm so glad you told me this. I really empathize with you. But I think nothing is so bad that you give up and say, burnout. I give up. By giving up, you have lost the battle. You're really burnt out. And your parents have also burnt out. I think it's not fair. I think it's not fair to you and not fair to your parents. So I think you should still keep on trying and discuss with the lecturers any ideas how they can do it. You all are much better at computer than I am. Suggest some ways and discuss how you can do it. So the COVID is quite smart, but we can be smarter. We are human beings. We can do something better. Okay?
Yeah, okay. So before that, I had considered to quit and just get a job instead. But after listening to Prof advice, I think I can reconsider to stay in med school and try to think out of the way.
I think you should. I'm now teaching for 50 years. I'm a doctor for 54 years. I assure you, life is not easy. As a doctor, many times in my life, especially in the first few years of my life, I really thought, I think this is not my line. I think I want to leave. But I took it as a challenge and said, by God, you mean I'm going to give up after all these years studying, going through difficult time in school and college and everything, going to give up because of this, because of that? Rubbish. I'm going to show myself and show to everybody else that you can succeed. The fact that you, Mr. Anonymous, and everybody else made it to the medical faculty in UTAR shows you are not normal. You are extraordinary. Look at yourself. Look at your classmates. How many of them made it to medical school? So you are above the rest. Why should you fall back? Because of COVID? Rubbish. You can win. You can succeed. I think all of us must take comfort from the fact that we as medical students and doctors, we are two cuts above everybody else. Otherwise, we would not have made it to medical school. We're not going to give up because of the virus. But that's why all the pilots and all that, they can't fly. But they're selling nasi lemak. They're driving delivery trucks and so on. Because they are capable. Why can't they succeed? Until such time, things change. So don't give up. Don't give up.
Yeah.
Okay? Good.
Yeah, I think, Mr. Anonymous, this is just a temporary exhaustion, a temporary challenge, but I'm sure you can get through this. And it's tough, especially for students, especially everything being online right now. But I'm sure we will one day be able to have face-to-face classes as well. And then we'll be able to remember why we came into med school in the first place. Yeah.
Hopefully it does.
So, yeah.
And don't
So,
disappoint your parents.
I will try not to.
Actually, to be very honest with you, that's what kept me going when I was overseas studying. Life in where I studied in India was tough. It was tough. It was very tough. Luckily, I had no financial problems, and my parents, well, my mother died when I was overseas. I couldn't attend a funeral, but my father and brother and sisters all were very supportive. But what kept me going was I cannot disappoint my parents. They put up so much faith in me, so much money put out for me. They're expecting so much from me. I cannot give up for them. I will come back. I will come back and I will succeed. Well, that's why I'm here. That's why I'm here. Okay? So, Anonymous, please take heart, work harder. Don't worry, the COVID will go off soon. Even if it doesn't go off soon, we'll find a way around it.
Yes, I agree. We are overcomers. So on call right now, on our second caller, we have our second caller right now, and they are interestingly a couple calling in, and their names will be Salt and Pepper. Thank you so much for calling us. How are you feeling?
Okay, so far.
Yeah, okay.
Feeling okay, huh? Okay, so maybe you can tell us what you are going through as well, and then like you can share with us, and then our professor here will guide you and give you some advice as well.
So because of COVID, we've been like studying everything online, so it's been difficult to meet friends and all, so we kind of sometimes lose motivation to study. Yeah, like at home sometimes we feel like not doing anything. There's no motivation to study.
May I know if you're going through exams together?
So far, we are not having any exams yet, but soon we'll have one.
And are you well prepared?
Not really.
Exams, how are you holding up?
Still good, but to have my other half studying the same course as me, I guess it's a good thing so that we can check each other's level of understanding and we can check on each other more frequently so we can ask each other questions also. So like which question we don't know, then we can ask each other. I think this is a good thing, like we can bond together. So yeah, I think we can motivate each other.
Salt and Pepper, do you guys go through any problems, especially during this pandemic right now?
Not much of problem lah.
Yeah, let me tell you. Actually, as I said earlier, everybody is going through this difficulty, so it's not unique in any way. And in fact, I had to go through because we were about 4 months not teaching, because of the timetable and everything changed because of they had to repeat some parts and all that. About 4 months, I had no teaching, and it gets very boring. I'm used to teaching. I've been teaching for almost 50 years. So it's to suddenly find myself not doing anything. So this is a common problem of people who are in the pandemic. Of course, luckily I'm still working. So financially, not really a big problem. But in terms of occupying my time, you know, finding interest in what I'm doing, the solution to this is exactly what is the solution for all students. When they find that the COVID has ground them to a halt, for example, now everything is online. So formally you get up, you get ready, dress properly, wear your clothes properly and everything, and you go to college to teach, and then you have a break, you have a snack or something, come back and learn, and then you take down notes and this and that. Now, the actual numbers of teaching has dropped very drastically because, for example, in the medical field, there's no more clinical teaching. So everything is online. So what happens is You cannot go on teaching online for 5 hours continuously. Cannot. Not possible. Your attention span goes down. I get very tired. So we have frequent breaks. But still, nothing like seeing the real patient. It's like even in your year 1, year 2, you got lab work, you got visits, and you come back here, you go there, you do this project. Now cannot do the project, cannot go out, cannot go anything. So what happens is the actual teaching contact time is diminished. So how do you occupy that? Well, you occupy that by trying to organize something individually for himself or herself. It's like retirement. I have a friend who asked me the question, I'm thinking of retiring, what do you think I should do? I said, even if you retire, you must keep a routine. You must get up every day at a particular time. Like when I was teaching, I used to drive every day to Sungai Long or to Ampang, and I leave my house at 6:30. So even during the COVID, automatically I get up at 5:30, 5:45. I have to. I force myself. But there's nothing to do. So I tend to go back to sleep. Then I get late. So the temptation to prolong your sleep and prolong your laziness becomes worse. So that's where the challenge is. You have got to organize a time as though teaching is going on. Of course, you can make a slight adjustment. Maybe you can see a little more TV compared to before. You cannot follow it exactly. So if every morning you get up at 6:30, you get up at 6:30. You go to your bathroom, have your wash, and have a light breakfast, whatever it is. And then at 8 o'clock, you start studying. But you can have after maybe 9 o'clock, you have a short break. Then 9:30, start again. So you must have a routine. You must build up a routine. That's the only way you can keep up. Of course, it's not 100% because you can't go to hospital, you don't see patients. For clinical postings, the seeing of patients, interviewing itself is a stimulus to make you more active. This one is, the simulated patient is just a big bluff. No matter how much you tell me this is a real thing, it is not. So in my work, in my particular work, I run a stress management clinic. And during the time that COVID came, we're not allowed to go to hospital. So I managed to get permission to see patients, but online. So, of course, it's not as good as seeing the patient face to face, but we have actual patients. So morning, 8 o'clock we start teaching up to 9:30. Then 9:30 we see patients until about 12:30. 2 or 3 patients. So routine. So the students also, because of the distancing, there's a problem. Distancing, mask and all that, and sanitizing and all. The whole stress management clinic has got to be sanitized. So students come early, sanitize the place, listen to the lecture online, some at home, because we can't have more than 4 or 5 students in the stress management clinic. The rest are at home, they're in Ampang. Then at 10:30 we switch over. So they go back, the others come. Then we go on discussing. Everybody follow up the same cases, everybody see online. Either you see online or live, up to about 12:30. The patients, so sometimes it can be longer. It can be 1:30, even 2 o'clock, 2:30 even. So that way, you simulate a clinical environment maybe about 65% of normal. Same thing you must do as a medical student. You have to cut yourself dry, not because you're staying at home now, so you can just Anytime go and raid the toilet, raid the fridge, run to the toilet, call your friends, telephone. No, stop all that. I'm online. Okay? So no
Yes.
compromise. At least 65%. You have a slightly longer holiday. That's all. Unless you do
So
that, you will slide back to laziness, don't know what to do, you get bored, irritable, and these salt and pepper will be fighting among themselves.
I see. So, Prof,
Okay.
so what you're saying is that even though to make up for the lack of contact hours that we're having right now, to make up for the lack of human contact also that we're making up right now, we have to still try our best to maintain a routine as best as possible, even if it's not to up 100%, so
Yes.
that it can keep us motivated and keep us going,
Yeah.
right? So that we don't slip into a period of laziness, procrastination,
Yeah.
and then that would lead to bigger problems also. Yes, I
Yeah.
think that's very good practical advice for
Yeah.
us students, especially.
Just one more thing. One more thing. Uh,
Mm,
I'm not very computer savvy, as I told you last time. What I
mm,
learned is a lot of material, not all
yes.
correct, mind you, not all correct. A lot of materials available in the internet, in YouTube.
Mm-hmm.
For
Mm,
example, let's say in my field, in psychiatry, you're talking
mm,
about, say, depression. You go into YouTube and say depression, you can see
mm,
hundreds of YouTubes.
mm,
This one you can see on your own during the COVID time because you got nothing else to do. So your working hours, let's say your actual teaching by your lecturers is maybe 2.5 hours. All right?
mm,
Rest of the
mm,
time, nothing. So what do? Well, go into the internet. Today, he talked about depression. So you go and look at depression. So
mm,
the advantage is that you watching is like watching a movie. No? So it's quite entertaining, but some of it is bloody stupid. You must know how to avoid the stupid ones. And then you look at something else. Say you are doing medicine and you learn
mm,
today about typhoid fever, history of typhoid. You go into the internet, there are a lot of it. So you can use
mm,
the internet and
mm.
the computer to tamba, to supplement, which normally you won't have much time because you're so
Yeah.
busy. So now you need to channel your energies onto this. Now, one of the things I do,
Mm,
because I do that also, I see
mm,
YouTube every day now, every day.
mm,
Some of it my own interest, some of them just news and so on. But
mm.
I do one thing is that I also make PowerPoints,
Um,
which I don't use straight away, but I think that when the students come on stream, I can show them this. And I revise the PowerPoints,
mm,
correct it again, correct it again, correct it again. So many of the PowerPoints I'm using now, the teaching just started on the 27th of September. And many of the PowerPoints using were made during the COVID time. So
mm,
nothing like keeping yourself busy, but it must be an area of
yes.
interest. Now,
Yes.
I assume that all
Mm-hmm.
of you are in medicine because you're interested. So
Yes.
you look for it, the area of interest that you have, pediatrics or anatomy or physiology.
Mm. Yes, I think it's very important that we take this time to especially enhance ourselves in
Yeah.
different types of knowledge. Can be from different facets as well, not just in medicine, but we can also take time to discover ourselves.
Sure.
Yeah.
Hobbies. Yeah.
Yes. Prof, I would like to pass on a message from our salt and pepper. They said thank you. And they say
Don't
it's good
quarrel.
to have your perspective. Yes, it's good to have your perspective, and they will take your advice to heart as they continue to work on themselves, their studies, and also their relationship. Yes.
Good, good. Thank you. Thank you. Thank you very much.
Okay, so I think we have come to the end of our discussion. Thank you so much for this discussion, Prof. I'm sure our listeners have learned something new today. I would like to thank you on behalf of our team and also our listeners as well for joining us. To our listeners, mental health is a very broad subject, and this episode is in no way a complete guide on how to handle burnout or how to handle stress. If you are feeling overwhelmed or if you are in need of a listening ear, I highly encourage you to set up an appointment with our Prof Deva here. I'm sure he is very happy to help you with any problems that you might have. And it is very important for us to get the right advice. Thank you so much, Prof,
Thank you.
for being here today. Prof, do you have any closing statements for anything you would like to say to our students who are listening in here today?
Thank you very much for inviting me. I really feel very touched by what all you have gone through to get this organized. Personally, this is the first time I appear in a podcast. So thank you very much for this introduction. Well, I don't have much to say except what I've said all this time, but also that medicine is a unique profession. It's a unique profession. There are more ethics in the practice of medicine, more dedication, more commitment, more sacrifice than any profession that I know of. We sacrifice our lives for our patients without thinking anything. It's very similar to soldiers who fight for the country, except we are fighting for everybody. We are fighting for everybody.
Yes, that's true.
And it's lifelong. But I love teaching, and I do hope that all of you will see this COVID as a temporary setback, not a burnout, temporary setback. Get yourself together and fight this menace, succeed, and in the future, I want to see you as successful doctors, products of UTAR, who despite all the difficulties succeeded. Thank you very much.
Thank you very much, Prof, for your very heartwarming and very touching words. To our listeners, we hope you have enjoyed today's discussion and it has brought you some new insight. After all, at the Human Library podcast, we are all about learning from each other's experiences. Remember to subscribe to our podcast and also follow our social media as well so that you don't miss on any updates. Once again, my name is Michelle and I've been your host, and see you in our next episode. Bye-bye.
Bye-bye. Bye-bye.